So I'm so thrilled to be here with all of you guys today, and just to share a little bit about my backstory. So I'm a cradle Catholic, was born into the faith, but I was always kind of a little bit of a cafeteria Catholic. You just kind of check the box, go to Mass on Sunday, but not really having a true relationship with Jesus or Our Lady. And after, graduating from high school, starting at University of Dallas, which is a wonderful Catholic university, I managed to float through that institution as well as a cafeteria Catholic. Ended up coming to medical school, and although I still continued to go to Mass on Sundays, there were a lot of things in medical school and OBGYN residency that were very challenging to my faith. And in some instances, I would stand up and okay, I'm Catholic, but in other instances, it was very easy to just kind of keep a low profile. Ultimately, I got married, and I was married for 10 years at that point. And because I had never really learned priority in my life as far as marriage is concerned, how it should be is God first, and then your spouse, and then your kids, and then everything else. And that's how it works really well, because God fills you up and gives you the peace and the strength that you need in order to walk forward. And then when you prioritize your spouse next, you're taking care of your spouse is taking care of your needs. And so you don't have to worry about your own needs. You don't have to go on this quest to fulfill everything that you need, because somebody else is already watching out for you and somebody else has your back. And then comes the children, and you don't prioritize the children above your spouse and above God, because the children need to see you in relationship with your spouse. They need to learn how a marriage is supposed to work. They need to see you sacrificing for your spouse and prioritizing them first. And what I was doing was completely the opposite. I had a beautiful relationship with my spouse until we started having children. And the first one was great. We were both totally in love with our Blazy. And then the second one came along, and then that was still fine too, because I had two hands and I could manage two kids easily. And then I was pregnant with the third. And by this time, I kind of felt like my husband did not need a diaper changed, and he could feed himself. So he was kind of on his own. And God was great whenever, especially when I was in a really dark place, I would turn to God. But otherwise, he wasn't really a part of my day-to-day. So my hierarchy of importance was my two boys, and then the little one in my belly, and then my work, because I was an OBGYN resident and I was working all the time. And then somewhere in there was God and my husband. And when you have that kind of a priority structure, things naturally start to degrade, and you start becoming like two ships in the night. And then our marriage was truly on the brink of divorce after 10 years of marriage. And thanks be to God, he sent so many people into my life. I was a child of a divorced family, and so I didn't learn a lot about conflict resolution and how to work through problems and come out on the other end. But he brought resources into my life, and he brought people into my life that taught me the importance of fighting for this marriage, and the importance of helping my children not become children of a divorced family. And he helped me to see that myself and my siblings all exhibited every single issue that tends to come along with being a child of a divorced family. And I was shocked when I read it. I was like, oh my gosh, that's me in that book, and that's my sister, and that's my brother. And I definitely did not want that for my own children. So I decided at that moment that tooth or nail, I was going to fight for my marriage, and that somehow, through the grace of God, it would be saved. And thanks be to God, it was. And out of complete gratitude, I decided that I needed to do something so outside of my box to pay God back. Because in the past, if I'd been going through something difficult and God would come through for me. I'd be like, okay, yeah, I'll say a rosary, or, okay, I'll say a novena, or I'll do this, or I'll take care of this homeless person, or whatever. But this was so groundbreaking for me. This was so huge that I knew I needed to do something different. And so, of course, he provided again, and I came across Abby Johnson's Unplanned. And in reading Unplanned, I'm hoping many of you have either seen the movie or read the book, but if not, definitely worthwhile. In Abby Johnson's Unplanned, I learned the importance of praying outside of an abortion center, and that it could be done in a very kind, generous, compassionate, loving way. My impression prior to that had been that people show up outside of abortion centers and oftentimes are not kind to the women and don't say things in a compassionate, loving way. And ultimately the women end up going in out of fear of the people outside. And so when I read that, I knew that God was kind of calling me to pray outside of an abortion center. And I decided to go, and I showed up outside of 777 Apple Tree, which is the largest abortion center in Philadelphia, for sure. It's a privately owned center that ends the lives of 6,000 plus babies a year. It's on the back alley of a street called Apple Tree, and they are on the 7th floor. It's 777 Apple Tree. And it's just a very, very evil place. And when I showed up there for the first time, it was in the middle of a blizzard. And I was the first one there, and I had my car parked. And I waited, and finally somebody showed up, and it was somebody from our side. And they knocked on the door thinking that I was there for an abortion. And they were like, "Are you here for an abortion?" I was like, "No, I'm here to pray." And they were kind of disappointed. They were like, "Oh, okay, come with me." And so I went and I stood on the sidewalk and I started praying. He was like, "Are you Catholic?" "Yes, I'm Catholic." "Okay, great. We'll pray the rosary." So we prayed, and then I felt like God was just kind of like, "Okay, this is great, but you need to do more. Like, you're an OBGYN. You can't just stand there." So then somebody had some flyers. I grabbed some flyers, and I'm trying to talk to the women. And this was the first time I had ever done this. I had kind of, in my mind, based on reading the book, I had an idea of what I should probably say or how I should be. But it was literally the hardest thing I had ever done. You're watching car after car after car after car streaming into this place. It was 30 plus cars that morning in a matter of hours. And each and every one, that this is a woman who is carrying a child that is about to be killed. And it was so cold that my entire face was frozen. I could hardly speak, but tears are just rolling down my cheeks because I couldn't believe that this was actually happening. And somehow there was this one woman who came, and I think she was from Bangladesh, and I think she was just shocked to see a brown person there. And I think it just gave her pause. And in that moment, there was somebody else there who was able to talk to her and able to convince her. And then she ended up leaving without going into the center. And so everybody was celebrating. And I was like, oh, wow, yeah, this is what's supposed to happen. We show up at the abortion center and then people choose life. This must be what happens every time. And I didn't realize that that's not really what happens every time. But it was that moment that I realized the importance of that one life, just thinking about that one individual child and how that child will have other children and grandchildren and great-grandchildren. And that if your grandfather or grandmother was aborted, how many people would be missing from this world? And for most people, that's hundreds of people just up to this point. And it was just a really devastating thought to think of the impact of these places, and that this wasn't the only place that was doing it. There was 12th and Locust just down the street, and then there was Comley Road, and there was Warminster, and there all these different abortion centers where this was happening. And in my mind, naively, I was like, okay, great. I paid God back. I showed up. Now I'm done. I didn't realize he had other plans. And Pat Stanton, thanks be to God, that day encountered me. I don't know. Do all of y'all know who Patrick Stanton is? Stanton family? Yeah, a lot of head nods. So Patrick Stanton is from the Stanton family. His father, John Stanton, was the patriarch of the pro-life community in Philadelphia, started the Pro-Life Union, started Our Lady's House, started Guiding Star, and had been a gentleman who had prayed outside of all of these abortion centers in his latter years every day as he retired from his work. And so it just turned out that that day was the day after John Stanton had died. And so when Patrick encountered me, he said, "Who are you and what do you do?" And I said, "I'm a pro-life OBGYN." And it was really weird that I said that because I had never referred to myself in that way before. But he straight away, he said, "Oh, my pop sent you." And I'm like, I had no idea that his father had passed away the day before. And so I said, "I'm sorry, I don't know who your father is." And he's like, "Oh, my pop sent you." Turned out that John Stanton was a daily communicant. He had gone to daily mass every day, received Jesus, and every day his prayer was, "Jesus, please send a pro-life OBGYN." And so the timing was just impeccable. And the fact that I actually identified myself in that way was kind of strange. But he said, "So this is great. Now you can start a Gianna Center for us." And the funny part was I called myself a pro-life OBGYN, but I truly wasn't a pro-life OBGYN at that time. I was an OBGYN who was against abortion. But working at Holy Redeemer Hospital, which is a Catholic institution, I was practicing like every other OBGYN there, which meant that I was writing contraceptives for all of my patients. I was placing IUDs. I was doing all of these things, which are completely in opposition to what I believe now. And at that time, I honestly didn't know that there was any other way of being an OBGYN physician. And so when Patrick said, "You can start a Gianna Center for us," I had no idea what a Gianna Center even was. I didn't know anything about NAPR technology or an alternative to contraceptives for GYN care. And so I also had plans at that time to move to Dallas because we had gone through this rockiness in our marriage that God had now saved, and I wanted to be closer to the family so that Gerard and I would have more support and all of this stuff. And Patrick was like, whoa, you got to pray about that. And I said, "Okay, I will definitely pray about that." So then I let him know that I was waiting for a couple of signs to see whether God wanted us to be here or to go to Dallas, and that my husband would still go for interviews if anybody called, from Dallas, and that if he received something that he couldn't say no to, then we would move to Dallas. But if not, we would stay, and that would be our sign. And so Patrick Stanton gets on the radio, Holy Spirit radio, and he says, "I have never asked that a man doesn't find a job, but I'm asking that all of you pray that this doctor does not leave Philadelphia." And of course, his prayer chain was way stronger than mine. And so Gerard did get several offers, but none of them were things that he wanted to pursue. And so I reached out to Pat and I said, "Pat, so we're going to stay." And he's like, "Oh, I already knew that." And I'm like, "How did you know that?" He's like, "Oh, my pop came to me in a dream and he told me that you're going to stay." And I was like, okay, Pat now denies this. He says I'm making that part up, but I'm pretty sure that that's what he told me. Then it was so funny because I was like, "Pat, the only thing, there's one condition." And he said, what is that? And I said, well, we don't have any family here, so you have to adopt us. And he was like, yeah, that's no problem. I already have, 12 kids, you can be another one. And I'm like, no, like this is legit. Like when my kids have birthdays, you have to come. When in the summertime, we're coming to find you. Like if you go down to the shore, we'll be there. Like family. And the Stanton family has been like just so ridiculously amazing. The other day I was just thinking about my pro-life journey, and I was like, if this one man didn't stand up and push me to do the things that he asked me to do at the beginning, I would not be here right now. I wouldn't be doing all of the stuff that I do in my office. I probably wouldn't have my own office. So I am so, so grateful. But even at that beginning times, like he did crazy things for us. Like we were living in the city. I wanted my kids to go to a school that was in Jenkintown, Abington area. I would literally drive them to school, or actually, no, I would drive them to Pat Stanton's house early morning so that I could go to work. He would take them to school. Then he would pick them up from school and bring them back to his home. He would give them a snack after school, make sure they did their homework. And then I would pick them up in the evening. And then I would take them back to my house, giving them dinner in the car on the way back. And we did that for about 3 months. And his kids would help, and his wife would help, and he would help. And he never allowed me to pay him a cent for any of that. He was like, no, you're family. This is what family does. And they've just been an amazing force in our lives. He's, sponsor to 2 out of the 3 of my kids for confirmation, and just very much a part of our lives. But the biggest thing that he did for me was the day after that, when we met at 777 Apple Tree. He showed up in my office, and it was my day off, so I wasn't there even, but he left a book for me called The NAPR Technology Revolution. And this is a layman's book that was written by Dr. Tom Hilgers about the majority of the NAPR technology treatments and how they're different from what we would typically do as gynecologists. And it had the layman's information, but then at the end of each page, it had a blurb for doctors. And as I read that, I was blown away. 2 things in particular really just caught my eye, because after having my first child, I had experienced postpartum blues. And I had never been a depressed person at all in my life, but experiencing a touch of that postpartum blues helped me to understand the gravity of the situation that women walk through in the midst of postpartum depression. Just experiencing that for 2 weeks and feeling like there was a constant gray cloud over my head, and not being able to smile, and being afraid to even be alone with my child for fear that I would hurt my child. It was so scary. And they had a treatment in that book for postpartum depression, which was just a shot of progesterone. And within 24 hours after receiving that shot, the symptoms were radically reduced. And I was like, all this time, I thought the only thing you could possibly do for postpartum depression was to give them antidepressants. I had no idea that progesterone had anything to do with this. And then the second thing was ovarian cysts. And I'll never forget, when I was an intern in OBGYN residency, there was a patient who had a large, simple ovarian cyst. And she insisted that she wanted to go to the operating room and she wanted to have this removed. And so they took her to the operating room, they removed it. And then she had a bowel injury because a little spark flew and hit her bowel, and nobody realized it. And then there was this huge lawsuit and everything else involved with that. And I was like, wait a minute. In this book, it says you could treat simple ovarian cysts with a shot of progesterone. And within 24 hours, that cyst likely would have resolved. Her pain would have gone away. And then she could have repeated an ultrasound 48 hours later to see that it had resolved. So those 2 things alone really caught my attention. And I was like, what else is there that I have not been taught? So I'm like ravenously reading this. And then I look on the internet to see when is their next training. And then I realized that the next training is like a month away. And so I furiously called them and I say, do you have space? Can I come and be trained? And they're like, yes, you can come, but you have to do all this paperwork and whatnot. So then that day itself, I went to the drug cupboard, and for the first time I opened it and I pulled out every contraceptive that we had. And then I looked through every little information sheet inside of those contraceptive boxes. And I looked specifically at the mechanism of action, meaning how does this work? And on every single hormonal contraceptive, there is a backup mechanism of action which thins the inner lining of the uterus or makes the inner lining of the uterus inhospitable in some way. And when that happens, that is why these hormonal contraceptives are abortifacients, because they are not always preventing the formation of that embryo. Rather, the embryo is formed, but they are preventing the implantation of that already formed, already living, already perfect, already with a soul embryo. And that for me was like, I'm done. I can't do this anymore. And so I knew straight away when I read that book from Pat that this was kind of the line in the sand. And I could no longer write contraceptives as a Catholic, because at this point, after God saved my marriage, he was the only important thing. And it was like, I only want to do things that are in alignment with you. I only want I want my work to have you in the center of it. I want my family to have you in the center of it. I want you to be constantly present with me. And he had provided me with this way to continue my work without the use of contraceptives. Naper technology was the door that opened that led me to how I practice today. And it was such a gift for me to be able to understand how to evaluate a woman's cycle. This was something which is so ridiculous, but it was never taught to us in residency. We all learned about the hormone pathways and that, estrogen rises and falls, and that progesterone then in the second half rises and falls, and progesterone's low in the beginning, and that there's this LH surge that happens prior to ovulation. We all knew all of that, but nobody ever taught us what that means when you look at an actual woman's bleeding patterns and mucus patterns, and how to look at those signs and symptoms to be able to identify exactly what is going on, so that you can then understand exactly when and if she's ovulating. And then you can do tests at the exact correct time so that you can evaluate her cycle properly. And then you can actually treat appropriately. So this was just groundbreaking for me. In the past, I was taught that contraceptives were absolutely necessary because that was the mainstay treatment for every GYN issue. So if you have abnormal bleeding, contraceptives. If you have painful periods, contraceptives. If you have PCOS, contraceptives. If you are having problems with, you absolutely have to avoid pregnancy, contraceptives. If you have PMS symptoms, contraceptives. Like, there was nothing in GYN that we didn't initially try to address with contraceptives. And then if that didn't work, then it was like, well, can we do surgery to just remove the uterus and eliminate the entire issue? But this was just something completely different. This was the idea that we could empower women to be able to understand exactly where their fertility was every single day, and to understand exactly what their hormonal function was every single day. And not only the women, but when it was a husband and wife, they could do this together so that it would completely superpower the husband to be able to care for his wife, to understand where she was hormonally, so that if she was someone who was dealing with lower levels of progesterone and she had PMS, he would know before she knew that it was coming. And then he wouldn't take it personally, and he would pad the way, and he would help her in the house, and he would buy her the flowers that she needed. But this was just life-altering stuff. And once you have an understanding of when to check the hormones properly, then you can actually address the underlying issues. Because if you know what normal is, then when you do the test and you identify abnormal, you can supplement back with the correct hormones at the right time. Or you can have the person do a cleanse so that they can eliminate the excess hormones. NAPRO technology was great, and it still is. It's still kind of the bare bones of what I do in my office. But once you step through that door and realize that almost everything you learned in medical school was about putting Band-Aids on top of things and treating symptoms rather than treating the root cause of underlying conditions, then you start to question, what else didn't I learn? And that really led me to seeking to understand what is happening with the thyroid, and what is happening with gut health, and what is happening with all of this toxicity, and how can we cleanse our bodies so that we can come back to that original state that God created us in, because he has created each and every one of us perfectly, and he's put in our bodies mechanisms to heal. We just have to give our bodies exactly what they need as far as nutrition, rest, take away the stress, all of these things, so that our bodies can rejuvenate and our bodies can function well. And so even to this day, I am constantly on a quest to learn, but I think the most important thing that you guys need to know is contraceptives should never be the mainstay of treatment. Hormonal contraceptives are so bad for our population in so many ways. Number one, they alter the woman's physiology. So an example of this is her likes and dislikes even change. When she's on a contraceptive, the kind of person that she's attracted to is different from the kind of person she is attracted to off of a contraceptive. So she may be dating somebody the entire time using a contraceptive, get married to him, get off of the contraceptive because she wants to have a baby, and no longer be attracted to her husband. It's so ridiculous. The contraceptives do increase your risk of medical issues. So in some women, they can actually cause life-threatening blood clots. They can absolutely increase your risk for cancer. They definitely cause mental issues, depression, anxiety in many women. And it makes sense because it's basically giving the body estrogen and progesterone, and it's not even true estrogen and progesterone. It's kind of a chemical mimicker of estrogen and progesterone every single day when it's not normally supposed to be there. Progesterone is only supposed to be present after ovulation. So when the body sees this, it's trying to fight it. And it says, oh no, okay, let me just push up my estrogen more and more so that I can actually create a normal ovulation and have the right cycle. And what that results in is a lot of estrogen dominance, really high estrogen levels. And when you have crazy high estrogen levels, that increases your risk of breast cancer, uterine cancer, all sorts of issues. Heavy bleeding, uterine polyps, fibroids. And so it's so important that people really start to understand all of these issues that come with the contraceptives. And so often, like even in the Catholic Church, because not everybody understands that contraceptives are doing this, quite often they'll say, yes, you shouldn't use birth control to prevent pregnancy, but if you have a medical issue, then it's okay to use it. But what's not understood there is the harm that it is doing, and the fact that this person may be using this for a medical issue, but also on the side using it for contraceptives. And it's definitely an abortifacient. So yeah, it's just never a good idea. And the one thing when I was in training, it would be like somebody would come in and we would put them on a contraceptive, and then they come back with symptoms and we're like, okay, let's try this one instead. And then they come back with worsening symptoms and okay, let's try this one instead. It's just a never ending shuffling the contraceptives back and forth. It was the most boring kind of medicine that you could ever imagine. And it doesn't surprise me at all that many gynecologists ultimately they get burnt out. They're seeing patients 5 minutes each and all they're doing is pushing contraceptives. It's not fun. And so when I switched over my kind of practice to use only NAPRO technology to address GYN issues and to pursue the root cause of all of these illnesses and to help women to truly heal from the inside out, not only physically, but emotionally, spiritually, their relationships, to give them that sort of support and a place where they could talk about those things in my office, it was life-changing. And I am so, so, so grateful because every single day at my office is just such a gift. It's full of beautiful encounters with all of these amazing women who definitely only a portion of my clients are Catholic or Christian. We'll always have people coming in from many different faiths and many different beliefs even. And it's always a question of, okay, Lord, what exactly do you want here? And just kind of being open to that. But I'm so grateful to not ever have to use contraceptives again and to be able to be an advocate against them and to be able to spread the truth about them. So if anybody has any questions, I'm happy to answer. I don't know if I have any time even, but am I good? Okay.
I just had one, Monique. So to be clear, so you went through medical school, residency, all you went through, and you never heard of NAPRO technology, Billie's ovulation, symptothermal, any of that stuff?
No, so what I did here was in one part of physiology, they would talk about the spin barquette. And so they had this one image with the cervical mucus. And they said, the cervical mucus increases as estrogen increases. And that was the end of that. And then when they were talking about contraceptives, they would say, and some people use natural family planning methods, but that's never a good idea. The failure rate is horrific, and you should never, ever go there. Now, I think that they were kind of stuck in the past and that they had no idea about NAPRO technology, about symptothermal methods, about all of these newer methods that made a lot of sense. They were thinking more to, what is the one with the wheel and the calculations, and I always forget the name of it. There's another name for it. It was like they had this little wheel and you had to like put in the numbers and there was like all this calculations that you had. When I went to, who's the Theology of the Body guy?
Christopher West.
Yes, I went to Christopher West's home to film something. And he had his mother's wheel. And he was like, I just want to show you this. This is how they used to calculate when it was okay, when they were not fertile and when they were fertile. And I was like, what? Are you kidding me? It was really challenging. And so thanks be to God, the majority of these couples that were using that even were totally open to life, right? So it was just their attempt at spacing pregnancies, which didn't always work very well because it was so convoluted. But with symptothermal and all of these different mucus-based methods where you're incorporating all of this information, the quality of the cervix and the position of the cervix and, how it feels and what your mucus looks like and what your temperature is. Like there are so many different things that you can use to help fortify your belief of where you are in your cycle. And those are all things that are given by God, in the NAPRO method, they're strictly mucus and biomarkers. But in my office, I'll always tell people, whatever gives you the comfort that you need to be able to verify what your point of ovulation is, use it. Whatever makes you comfortable, because everybody's different and everybody responds differently. But yeah, basically, I went through all of that education and never really understood anything about it.
That's amazing.
And especially, it's kind of crazy because working at a Catholic, very much in quotes, Catholic hospital. It was so frowned upon to do what I did that when I decided to give up contraceptives, all of the women in the practice that was cross-covering with us refused to cross-cover with me anymore. And basically they said I had to stop delivering babies because if I wasn't going to write contraceptives, they weren't going to work with me. And administration refused to stand up for me, even though we were all paid, on the same level. We were all, some of those doctors were even junior to me. But they were like, we can't take the risk of, upsetting them. If they don't want to work with you, they don't. I'm like, you're the one who hired us. You can absolutely tell them I'm not doing anything wrong. Yes, you have to work with her. Like, what do contraceptives have to do with labor and delivery and prenatal care? This is ridiculous. But it was all God's plan, because if I had it my way, I would have just been a physician in that office, and I would have been doing NAPR technology while they were writing contraceptives, and I would have been doing the prenatal care and then delivering the babies, and I never would have been here now. And rather, his plan was something very different. He incrementally took me out of that situation, first by taking away labor and delivery. Next, he brought COVID, and in the midst of COVID, when I stood up and said that I refused the COVID vaccine, then I lost my hospital privileges and I couldn't operate anymore. But then he found me a space just across the street in their medical office building in a suite that was owned by somebody else. And so I moved my practice across. And then it was, you have to own your practice, you have to own your employees, all of which I had no desire to do whatsoever. But he made it happen so that at this point, I own my own practice. I hire my own employees. We do their own, payroll and taxes and all of those things. And that means that I have the final say on what is taught in my office. I have the final say on what we offer in my office and how the patients are treated in my office, and whether we have holy pictures all over my office, and whether we play Christian music all over my office, and all of that. And I never would have had the freedom to do that. I used to get calls from the administrator at Holy Redeemer when I would pray outside of the abortion center. They're calling me saying that you're outside of the abortion center harassing people and you cannot represent our hospital out there. I'm like, I'm not representing your hospital. I'm representing myself. This is my day off, and I'm praying outside of an abortion center and offering resources to women going in and out of the abortion center. And naturally they're going to call you and tell you this because they don't want me here because I'm effective. So yeah, you had a question in the back, sorry.
I asked this just out of curiosity. So I know your way of learning about NAPRO and NFT and stuff like that was usually just through personal experience. Was there a way to get a formal education nowadays with that? Oh no,
I actually went to Nebraska and I did training it was like a year-long training process. And I was officially trained in NAPR technology. But then since that time, you're correct. I have learned about all the other stuff, not through formal education, but simply by talking to different people and learning what they're doing and how effective it's been for them, and then offering it to my patients and seeing how it works in my own office. Yeah.
Thanks. This is really, really interesting.
I'm glad.
Twofold question. I know so many people, I'm in my mid-30s. A lot of my friends, close friends, are having a really, really hard time seemingly getting pregnant. And, a lot of data out there saying that, that's not true. Data saying it has absolutely nothing to do with contraceptives, but common sense tells me that that's not true. And you just said a lot of, actual, reasons of how contraceptives works that, aligns with my belief that does have something to do with it. Because a lot of people that have been on it since they've been 10, for acne or cramps, myself included for a long time, which, thank God, I didn't have any fertility issues. But question is, from your actual, medical experience, what is your personal thoughts on, is the prevalence and the prolonged use of contraceptives, being part of why so many women right now are having trouble getting pregnant? And two, would vapor technology potentially be something that could help if, contraceptives, if someone stopped? Have you seen that help?
Yeah, so I guess what I wasn't clear with is NAPR technology is not just to address every GYN issue, it's also the other half of it is infertility.
Yeah.
And so my practice is half, GYN problem visits and annuals and all that sort of stuff, but the other half is 100% infertility practice. And yes, I do believe that contraceptives have played a huge role in impacting people's fertility because of the fact that contraceptives never allow you to address the underlying issue. And so if somebody has issues with endometriosis or PCOS or something else, that's just fermenting underneath these contraceptives. And it's actually getting worse because contraceptives typically cause an estrogen dominance, which worsens all of those things. While they're on it, especially people with endometriosis feel much better for the most part because it's suppressing their cycles, at least trying to, and that prevents them from having these like peaks where the pain is so severe and it decreases their bleeding and thins their lining. So it seems to the patient that this is good medicine, like I'm not hemorrhaging every month, but the question is, why were you hemorrhaging to start off with, right? And once you get off of the contraceptives, then your body kind of goes back to that initial pattern. And they don't have the time that they would have had to address all of those issues properly, because now it's like, okay, I'm getting off the contraceptives because I want to be pregnant next month. And it leads to a lot more miscarriages if they can conceive because they're not addressing that underlying issues. Most women, honestly, most gynecologists don't really identify what a normal cycle truly is, right? They have we were taught a very wide, broad range. They'll say something like anything from 21 to 35 days is normal.
Everything's normal.
Yeah, that's your normal. I'm like, no, there's no such thing as my normal or your normal, just like it is in society. There's no my normal, your normal. There is a normal. And then anything outside of that is not normal. So you have to be able to identify the normal first to be able to identify if what you're experiencing is normal or abnormal. And most women don't know when their bleeding is really heavy because that's what their mom had or that's what their sister had or that's what their friends have, and they think that that's normal. So one thing that I'm doing right now is I'm developing an app so that anybody across the world can pick this up and answer a couple of questions, and it will chart for you and it will tell you, like, do you have very heavy bleeding or heavy bleeding based on, okay, you're using tampons or pads or cup or whatever. And it'll just ask you the appropriate questions that I always ask in my office. And then it will pick the sticker for you and say, oh, today was very heavy. And if it's very heavy, it will say, you should look at this video. And then the video goes to a little clip of me saying, very heavy bleeding is not normal. And this is why. And so I'm hoping that that will be a really great educational tool for a lot of women that have no idea that what they're dealing with is abnormal, so that they can then try and get help and hopefully get help from somebody who actually knows what they're talking about. So.
Do you know when that will be coming?
I'm hoping in the next few. It's almost done.
Oh, wow.
It's almost done. It's unfortunately, yeah. I said that about 2 years ago as well, but but it is like literally just right there. But soon.
Do you have time for another question? Okay. So in all the years that we've taught naturopathic planning, we would mention that contraceptives can cause cancer, but we don't know a lot, right? Yesterday, and I'm glad I heard it yesterday, and I'm glad you're here today. I was in I'm in a women's group at church. We went, offered a rosary at someone's house. One of our ladies has her daughter's has cancer. But afterwards, in a conversation, she mentioned that a coworker of hers, who has since passed, but she was diagnosed at age 24 with breast cancer. went through treatment and was cured, but it came back. She passed away at age 33. And she mentioned something I never heard before is that women, the younger you are, the more estrogen you have, and the cancer feeds on that. So it's, a lot of times they get more aggressive forms of cancer, and that was what happened to her. I don't know if that.
So
I don't know
there,
if you
there's a lot of, there are a lot of issues. I definitely do feel like contraceptive use is a setup,
that might have
right?
triggered it, right?
However, there's also like a major issue with radically low iodine levels in the majority of the population. And in talking to a lot of holistic, more integrative cancer doctors who have previously been, like me, allopathic doctors that then had this shift and wanted to do things with root cause medicine. They are also saying all of their breast cancer patients, they're shocked at how much crossover there is between thyroid dysfunction and breast cancer. And I have recently done so many deep dives on just thyroid and what we can do to try and help. And what I've realized is that there's a lot of people who have studied iodine and the lack of iodine. And when you give adequate iodine levels, which are way higher than what you would expect your iodine numbers to be in order to be adequate, when you get to that sort of level, you can actually reverse some of these breast changes. There were actually 2 patients that this particular physician had worked with who had breast cancer outright, and they refused chemotherapy and they refused radiation, and they just did high dose iodine, and they both completely reversed their breast cancer. So there's a lot to it. But the thing I think that's important to remember is that there is, in allopathic medicine, oftentimes they try and compartmentalize your body. And so the gynecologist will never think about the gut, and the lung doctor will never think about the uterus. But God created our bodies so perfectly, so capable of communicating throughout the body. And everything that you put into your body, every bit of stress that you experience day to day, your lack of sleep, what you're drinking, like everything impacts every part of your body. And so it's so important to think in more of a holistic manner and to try and understand how things impact one another. So, yep.
So I have 2 daughters. I'm thinking about both. One of them, 33, just died with problems. Are you taking new patients?
Yeah. Yeah. Yeah, we have, so I'm in my practice, I have a PA also in my practice, and I'm just hired a nurse practitioner as well. And all of us, I'm insisting that everybody practices the same way. And so I monitor exactly what they're saying and what they're writing in their notes and what sort of studies that they're ordering and everything else. So, yeah. Yeah, Karen has the website. So you will, it's naturalwomenshealth.com. Unfortunately, I keep forgetting to replace the cards in my wallet, and I give them all away. But yes.
I was wondering, the moms who come in and you see them after the baby and they can't breastfeed, is that a thyroid issue? Why can some moms breastfeed and other moms can't?
That's a really good question. I think the process of being able to produce breast milk has more to do with prolactin. And so there are, I'm sure, several different reasons as to why a mom wouldn't be able to breastfeed. It could be the latch, it could be the lack of prolactin, it could be stress, it could be that she's not sleeping enough, it could be she's not hydrating enough, it could be that she's drinking coffee, it could be, numerous things. So the best person to talk to in that case is a lactation specialist, honestly. So, yes.
Just wondering if you, in your app, information and education could be something for the men, the husbands support, because we really know less about the woman's cycle, and I didn't know anything until we
Started doing
introduced to natural family
yeah.
planning, and then wow. Really?
Yes, absolutely. That's a very good point. And at the moment, I do not have anything specifically aimed to the husbands in my blog, but I will definitely keep that in mind and try to create some things and maybe create some TikToks and stuff about that. Yep.
I'm just curious. So, within the medical community now, as someone who is very much standing up saying, like, I'm Catholic, I'm also an MD, and this is what I'm going to do, and I'm going to align my practice with my faith. Obviously, that is kind of an anomaly, unfortunately. Did you see, or have you seen more of like a community or people reaching out to you? Like, are there more people you think that are going to take this similar
Oh,
shift that
absolutely. Absolutely. I have heard from so many different people just by walking this walk, medical students in particular, that are like, oh my gosh, Dr. Ruberu, I was afraid to go into OBGYN because I didn't know how I could possibly do that and not do abortions or not like have to write contraceptives or whatever. What I always tell all of those students is that if God has placed it in your heart to become a physician, you trust in that and you keep walking forward. And you have to be authentic and you have to stand up for what you believe, but trust that He will open the doors that you can walk through and He'll bring people into your life that will help to defend you and protect you. But you just keep going forward because He needs you to be that physician. Because like in Philadelphia, there's two of us, myself and Dr. Delia. And then you go out to Jersey and New York, there's another like 4. So we are so needed. When you think of the number of OBGYN physicians that are in Philadelphia, it's like hundreds, right? At least. And so we need many, many more people. And when I hear that somebody's considering moving here, or I'm like, great, come. There's plenty to do, So it's always wonderful. And especially, I think they really, in our training, there was a lot of fear that was kind of bred into our training. Like, if you step outside of the box, nobody will defend you and you'll be on your own. It is the worst thing in the world for you to consider being a solo practitioner. Like, these are the thoughts that were in my head all through residency. I remember when I first started working at this hospital, there was one solo OBGYN physician. And I remember having a conversation with him, and I'm like, why would you ever choose to be solo? I don't understand. And he was like, I love my patients. And I was like, yeah, but like, you're working every night, you're delivering babies every night, you're doing, everything. Like, how do you have the strength to do that? And he was like, well, my patients are very respectful of my time. And yes, I come and deliver babies, and I think he had it a lot harder than I do because I had my privileges taken away from me, so I couldn't deliver any more babies. But I at least get to sleep at home at night, and I just do the GYN side, and I get all the baby pictures after the fact, so it's great. I have a wall full of baby pictures. But yes.
Thank you so much for your story. It's so inspiring.
Thank you.
My question is, do you have any words of wisdom or practical advice to us that may be in the medical field in talking to administration or our bosses about things we cannot do because of our faith? I don't know if you want me to give like a specific example.
Yeah, sure.
But I just think this doesn't really go along with maybe like nanotechnology. I work in adult health, hormone replacement therapy, transgendering them. How would you give any practical words or phrases?
So the office you work in is purely for hormone replacement therapy
Oh my gosh,
for trans?
no.
Okay.
No, I'm just wondering if one day a patient comes in and I have to, and it's like a man who's getting estrogen, and I'm asked to administer it as a nurse. I obviously can't in my conscience do that. How do I go to administration or my boss and maybe what's the best phrase I could say to?
So first, I would have a whole team of people praying for you, right?
Mm-hmm.
And then specifically at the time that you're going to speak to your boss, see if you can get a 3:00 appointment.
Okay.
And at that hour, if you can have the conversation while you're having people pray the Divine Mercy Chaplet for you, have the conversation and just say, I really love working here. I love serving our patients. I have utmost respect for every physician and nurse that I work alongside with. I love the environment. I have so much respect for you as an administrator. There's one small thing that in my life I have decided to live according to my faith.
Yeah.
And thus far, everything has been great. I have no problems doing 99% of what we do here.
Yeah.
But I would just like to get ahead of the situation. And I wanted to hear your thoughts on if a patient came in for this specific thing. Is it possible for me to ask somebody else to administer that shot? Because according to my faith, I do not feel comfortable doing so. And just see what happens and trust in God. You know, the worst thing they can say is, no, you're going to be fired. And I promise you, if you're fired for that, then God will create a far better job for you with, you know, far better community and totally in alignment with your faith. But never hesitate to stand up for your faith. Because as Christians, we have to constantly remind ourselves of everything he went through for us on Good Friday. I mean, Jesus was whipped on both sides until his flesh, his skin was off of, like you could see his bones. And then he carried a cross that had shards that were poking into his body. And then he lay down on the cross and allowed them to crucify him. And despite, like, he is just such an amazing God that he humbled himself so much to come into this world as an infant, born into a smelly stable. And then he did all of that for us on Good Friday. Beaten, spat upon, people saying the worst possible things to him, all for a useless people who wouldn't go and like beat up everyone around him to protect him. And then, after rising from the dead, spending time with them again, ascending into heaven, he decides to imprison himself and humble himself again in a piece of bread so that he can be within us every single day. There is nothing we shouldn't be willing to give up for him. He is number one, that's it. Like, there's nothing ever that we shouldn't be able to sacrifice for him. What's a job? He'll find you another job. Don't worry about it. Any other questions? Yes.
Yes. Just wondering about the nutrition in your app or in your practice, because you said that everything that take care of your body and your body will heal yourself. So
Yeah.
it's it's a lot of processed food and all the stuff. So just wondering what we can change a little bit.
I think you already know the answer to that. I think every single one of us knows the answer to that. We all know that the healthiest foods that we could possibly eat are the ones that have the least number of chemicals that have been applied to them, that are fresh, that are raw, that are less cooked than others, that don't have preservatives in them. Whole food diets where you're eating as much like fresh greens and leafy vegetables and fruits, and there's several different diets out there. Some people say that the carnivore diet is the best thing, and other people say that the Mediterranean diet is the best thing. And I think everybody's body is a little bit different as to how you respond to different diets and how you feel. So you really have to listen to your body and see. Like, some people definitely, dairy is not a good thing for them. And they'll know 30 minutes after they eat or drink dairy that their body doesn't like it. So that's kind of a definite sign that you have to take that out for now. And oftentimes, I think for me, and people don't like to hear this, but the biggest thing is the caffeine. So I always tell all of my patients to completely cut out caffeine 100% because caffeine acts as a diuretic. It makes you lose your water, and then you end up dehydrated. And when you're dehydrated, your body is looking for water, so it's sucking back all the water from your gut. And then you're sucking back all of the toxins that your liver has packaged up and put into your gut to get out of your system. So you end up with just never-ending buildup of toxins in your body that it's very difficult to get rid of. Most people don't go to the bathroom often enough. They're not eliminating their toxins, and it's all getting sucked back over and over and over. Yes. For a couple of different reasons. Number one, all of the COVID vaccines were in the manufacturing process. They used the stem cells of the aborted babies. And so I did not, as a pro-life OBGYN, I didn't want to have anything to do with putting anything into my body that had to do with aborted fetal stem cells. Number two, this was a vaccine that was not, it hadn't been around for a long time. There was no real research done on it. It was not well studied, and they were telling everyone that they had to take it. And I'm like, hold on, pause. I don't want to do this. Definitely didn't want to do it for my children or my husband. But yeah, I've always been a much more holistic kind of person. Always, in our family, we've always first gone to like colds, coughs, that sort of stuff. It's always been vitamins, oil of oregano, silver, things like that. And so the opposite idea was that you could get the COVID vaccine and take your chances with that, or there were definite natural treatments for COVID that were absolutely working for people. And so we went the ivermectin route, and we bought a ton of ivermectin on Amazon, and we used it frequently, and we're still here. Yep.
Just one question about kind of on piggybacking on that. Have you heard about people who have taken the vaccine who have had fertility issues? And just very curious.
So the issue with the vaccine was that it really was such a social experiment, because even in the vaccine itself, every batch had a different amount of COVID spike protein in it. And so some people had very large amounts of spike protein, and the hypothesis is those are the people that died instantly, or those are the people that got strokes very quickly and passed away. And then others had very little spike protein in it, and many of those people didn't have any symptoms. But my experience, which also kind of fortified my belief that this was not anything I wanted anything to do with, is that I had a ton of postmenopausal women who started bleeding heavily. The women who had bleeding issues to start off with started hemorrhaging. Many women had miscarriages out of my practice that had taken the COVID vaccine. So thyroid, anybody that had an autoimmune condition, it like skyrocketed. There was actually a letter that was from, I think I have it on my phone even, but it was, there was like a military professional who they had done tests on all of these young, healthy military kids. And they were all forced to vaccinate, being a part of the military. And they had documented the number of cases of different kinds of cancers and all of these things, and the numbers were ridiculous. And so, yeah, I definitely believe, especially depending on the batch, there was a lot of harm that came from it, unfortunately. But thanks be to God, there's a lot of people that also did the work to cleanse. And there's been a lot of healing after the fact, but there's still people that suffer from side effects of having received the shot, I believe. Okay, I think that's it.